Hello, hi, good evening, Mr. Chakravarti. Hello, hi, Mr. Sharma. Hello, hi, Srinivas ji. Wow, what a great AccuCheck Wealthy family we have who, even on New Year's, is eager to join today's session. Hello, good evening. Hello, Mr. Terkhedkar, good evening. Hello, Mr. Chakravarti, good evening. Yes, let's wait for our AccuCheck Wealthy family and then we'll start with today's session. Today's session uh, will focus more on diabetes and heart health because I think with new year all of us have new resolutions and many of you have reached out to us asking for information on heart health. So let's help our users to understand them how heart health can be affected if diabetes is not controlled, how heart health is something which needs to be taken care of. We have a special person, we have a special webinar speaker today for discussion on heart health, a doctor by profession and in-house clinical expert. We'll discuss about this in a minute. Let's allow all our AccuCheck Wealthy family to join in and then we'll start with today's discussion. Hello, Mr. Yadav ji. Good evening. I hope you are doing well. Thank you for attending today's session. Today's topic is one of its kind, and we'll be discussing a lot about heart health, its association with diabetes and lifestyle disorders, and how it impacts our health overall. And if not taken care at proper time, how it can impact diabetes management. All right. Without any further wait, let's start with today's topic. Yes, so let me introduce today's speaker. We have Dr. Sneha, Dr. Sneha Damse, who is a senior clinical expert associated with Wellthy Therapeutics, a doctor by profession who has an experience of more than 5,000 patients as a part of the program, and somebody who's deeply involved in creating थेरेपी इंफॉर्मेशन. आप लोग जो वीडियो देखते हैं, जो ऐप में कंटेंट पढ़ते हैं, आर्टिकल्स पढ़ते हैं, स्नेहा हैज बीन अ पार्ट ऑफ दिस टीम and she has been recurrently helping our users to understand, improve, and have a good knowledge base for all the therapies across Wellthy. So we are glad to have you, Dr. Sneha, with us today. Thank you so much for joining us. Over to you.
Thank you, Rutuja, for the introduction. Good evening, everyone. Thank you for joining today's session. We understand that it's New Year's Eve, and we're glad that so many people could still join because today's topic is something very important, which is diabetes and heart health. We will be seeing how does your diabetes impact your heart and how does your heart react to the increased levels of blood glucose in your blood, and what can we do, हम क्या कर सकते हैं in order to prevent all of these from happening, because obviously there are various steps that you can already take or you can discuss with your health coaches in order to prevent something as big as heart conditions, which is very common in diabetic patients. So we'll just start off with it. So before getting into कि डायबिटीज इम्पैक्ट कैसे करता है आपके हार्ट को या फिर कैसे ये डिजीज डेवलप होती है, हम देखते हैं कि ये डायबिटीज और हार्ट के बीच में क्या लिंक है और डायबिटीज कैसे हार्ट डिजीज को कॉज करता है. So just to give you some facts about what your heart is and how does it function, what are the various parts of your heart, so that you also better understand कि आपको भी बेहतर समझ में आएगा कि कौन आपके हार्ट का कौन सा पार्ट है जो ज्यादा इम्पैक्ट होता है और आप क्या कर सकते हैं. तो ऑब्वियसली आपने काफी बारी सुना होगा, एक आपका हार्ट आपके लेफ्ट साइड के चेस्ट के लेफ्ट साइड में लोकेटेड होता है, काफी छोटा होता है, इट्स नॉट बिगर देन द साइज ऑफ योर ओन रिस्ट, your own fist, and every minute your heart is working very very hard. Every minute it is pumping out 5 liters of blood. And obviously, since it's such an essential organ, since heart is pumping the blood throughout your entire body, it is important to take care of it, and important to reduce any risk of heart disease that may develop due to your diabetes. So we all know how important the heart is. Just to give you some facts here and there, and why we want to discuss it with our patients is because आपने काफी बारी सुना होगा कि डायबिटीज पेशेंट्स को इंक्रीज्ड हायर रिस्क होता है काफी सारी बीमारियां डेवलप करने का, जैसे कि इसमें से है हाई ब्लड प्रेशर, and someone who has high blood pressure, these patients also have a higher risk of developing any cardiac diseases. Cardiac diseases are nothing but heart diseases. And anyone with diabetes, it's been proven, there have been various studies, काफी studies हुई है, research हुआ है कि 2 out of 3 diabetic patients will end up developing a cardiac or a heart disease if proper care is not taken, or proper precaution is not taken. If you're not taking care of your physical activity, of your food that you're eating, of all of the lifestyle habits that you have, then you will end up, having an increased risk of developing a heart disease. Another fact is, I think ये भी आपने काफी बारी आपके health coaches के साथ discuss किया होगा कि people who usually smoke on a regular basis have double the chance of developing not just diabetes, but also uh, any other heart conditions along with high blood pressure, high cholesterol, and all of those. So as you can see, given how high the risk of heart disease is in diabetic patients, it is very important to take care or take precautions in order to prevent that from happening. Because once it starts happening, it becomes a lot more difficult to manage it. So it is important कि उसके होने से पहले ही हम इसको कंट्रोल में ला दें, ताकि वो कंडीशन डेवलप ही ना हो. नाउ डायबिटीज और काफी सारी जैसे डिजीजेस होती है, मैंने पहले कहा कि दे गो हैंड इन हैंड, and all of these diseases are very high risk. These are very dangerous diseases, out of which heart disease is the most common one, and it is the most dangerous one, and hence that is why we feel it is important that you know how to take care of it. Like I said, people with diabetes are more likely to develop a heart disease at a younger age. Usually हम देखते हैं कि heart disease काफी older age patients में होती है, जैसे हम 40 क्रॉस कर दे या 50 years क्रॉस कर दे तो तब जाके ये disease develop होती है, क्योंकि with age there are certain factors that play into account, and that is why these people develop heart disease. However, if if you've had diabetes from a very young age, like if you've developed diabetes in your 20s or your 30s, the chances that you will develop a heart condition early go drastically up. There are various conditions within diabetes and heart diseases that act as risk factors. Now, risk factors are something that we call in the medical community. These are the factors that increase your chance of developing a certain condition, that put you at risk of developing a certain condition. Some of the conditions that are risk factors for heart disease are high blood pressure, unhealthy weight, or very high weight for your own height, obesity, overweight. High cholesterol is another factor that adds to this. And like I mentioned, people with diabetes are 3 times or 2 times more likely to develop this condition and have any kind of an impact due to this disease. But obviously, any condition, if you know that you are at a high risk of developing, अगर आप जानते हैं कि आपका रिस्क ज्यादा है हार्ट डिजीज डेवलप करने के लिए, So there are certain steps that you can definitely take and manage in order to prevent that future from happening. And proper attention and professional care, regular checkups can significantly lower your risk for heart disease. And just some minor changes in your day-to-day activities, छोटे छोटे changes आपकी lifestyle habits में अगर आप कर दे, तो आपका चांस काफी कम हो जाता है और आप डेवलप भी नहीं कर पाते, आप डेवलप भी नहीं करेंगे हार्ट डिजीजेस. So let's just give you an idea of what the heart is, and what part of the heart gets more impacted by diabetes, or even the other risk factors like high blood pressure or high cholesterol that we talked about. So, like I said, it's a very small organ, but it's very important. It's not bigger than the size of your closed fist. It's divided into four different chambers, and there are different arteries and there are different veins that carry blood in and out of the body, out of the heart, and they supply it to the rest of your body. The major function of the heart is to act as a pacemaker. There's an electrical pacemaker within the heart that keeps on contracting this heart. And due to this, the heart keeps on pumping the blood on a daily basis. The various arteries or the different blood vessels that are coming out of heart, these are what are supplying blood to the rest of the body. And if anything ends up happening, अगर ये arteries में blockage हो जाए, in blood vessels में blockage हो जाए, then what that is something that ends up causing cardiovascular diseases or coronary artery diseases. So heart से related तो काफी diseases होती है, but some of the main diseases that usually end up impacting diabetic patients, and some of the most common conditions that we come across are called coronary artery disease. Now, coronary artery is the artery that is the major artery that takes the blood, the purified blood or the clean blood out of the heart, and it supplies to the entire body. This if this artery, if anything ends up happening to this artery, अगर इसमें blockage हो जाता है या तो फिर वहाँ पे कोई injury हो जाती है, then obviously it will end up impacting the rest of the functions of your body as well. And the major reason for the blockage happening, क्यों इस आर्टरी में ब्लॉकेज होगा या तो फिर क्या इसका इम्पैक्ट होगा, उसके बारे में हम अभी आगे डिस्कस करेंगे. ओके, सो जैसे मैंने कहा कि अगर उस आर्टरी में कुछ हो गया तो जो आपका ब्लड पंप कर रहा है हार्ट, वो उसका कैपेसिटी कम हो जाता है और दूसरे जो ऑर्गन्स होते हैं आपके बॉडी में उन उन तक वो ब्लड पहुंच नहीं पाता. नाउ हाउ डज डायबिटीज स्पीड अप हार्ट डिजीजेस, और व्हाट इज द रीजन फॉर डायबिटीज कॉजिंग हार्ट डिजीजेस? Now, जैसे मैंने कहा, coronary artery is one of the main arteries that is carrying the oxygenated blood or the purified blood out of the heart and to the rest of your body. Now, artery is a small vessel, and it has a narrow passage. अगर passage में कोई plaque buildup हो जाता है या obstruction आ जाती है, तो इसके जो वॉल्स होते हैं, इसका जो पैसेज होता है वो काफी छोटा हो जाता है. एंड अगर आपका आर्टरी का पैसेज छोटा हो गया, वो नैरो हो गया, तो जो ब्लड आपकी बॉडी को सप्लाई हो रहा है वो भी कम हो जाता है. एंड सिंस देयर इज अ ब्लॉकेज, नाउ यू कैन प्रोबेबली कोरिलेट इट टू समथिंग एल्स. अगर किसी जगह पे, किसी रोड पे अगर ट्रैफिक हो जाता है, तो जो प्रेशर पीछे से आ रहा होता है वो भी बढ़ जाता है. everyone is just trying to get into that small space. So now imagine an artery also similar, in a similar condition. If the passageway gets narrowed, the blood that your heart is pumping out of it, the purified blood that they're pumping out of it, it finds it difficult to get it through that narrow passageway. So that is why your heart has to work harder. It has to pump harder in order to get the same amount of blood to the rest of your body. Now, there is a lot of strain that your heart is, coming under. क्योंकि it's not able to pump as much as blood that it used to when the artery used to be healthy, or when it was not narrowed down, or it was not blocked. uh, Now, what exactly is this blockage? ये जो blockage usually arteries में develop होता है, ये usually अलग अलग deposits होते हैं. The main deposit that you usually see in a plaque is due to high cholesterol. तो आपकी बॉडी में जो कोलेस्ट्रॉल होता है, आपने कई बार सुना होगा कि इट इज इम्पोर्टेंट फॉर यू टू कीप योर कोलेस्ट्रॉल अंडर कंट्रोल. Now this is one of the main reasons why you have to keep it under control, because once your body uses up, आपकी बॉडी ने जितना कोलेस्ट्रॉल यूज करना था, जितना फैट यूज करना था, वो कर लिया. Now if this cholesterol is present in excess, it will be carried in your blood, and if there's excess cholesterol in your blood, it will get deposited in the arteries. And because of this deposit, the arteries or the blood vessels will get narrowed, which will ultimately lead to a decreased blood flow. So now you sort of understand कि diabetes के वजह से क्यों हो सकता है heart diseases. और एक और कारण हो सकता है इसमें कि हमने काफी सेशंस में ये डिस्कस किया था कि जो हाई ब्लड ग्लूकोज होता है, अगर आपने आपके ब्लड ग्लूकोज को कंट्रोल में नहीं रखा, आपके ब्लड में ज्यादा ग्लूकोज सर्कुलेट हो रहा है, तो ये जो ब्लड ग्लूकोज होता है, इट हैज द पावर टू डैमेज योर ब्लड वेसल्स एज वेल. It can cause injury, it can cause ruptures or something like that, and that could be another reason why your arteries or your blood vessels get damaged. So it is also important to keep your blood glucose under control. Now, how does diabetes impact the heart, and what are the other conditions जो आपको जहन में रखनी पड़ेगी in order to maintain a healthy heart? So जैसे हमने कहा कि high blood pressure is one of the risk factors that increases your risk of developing heart diseases. Now, as the name suggests, there is a certain limit that your arteries push this blood out, and that is called as the blood pressure. It's the force or the pressure that the blood sort of puts on the arteries, and it needs to be under normal limits, because arteries, after all, they are biological things, and they can get damaged because of high pressures as well. Now, when the blood pressure increases, your blood is forcing its way through it, or it is sort of impacting the walls of the arteries because of this high pressure. And due to the force of this blood flow through the arteries, there is damage to the artery walls. And due to this damage becomes like a factor that can increase your risk of heart diseases. So having both high blood pressure and diabetes can then greatly increase the risk of you developing heart diseases. Just say in the previous slide, we saw that high blood cholesterol can cause a heart disease as well, because the plaque that gets deposited inside the blood vessels is nothing but fat deposits or cholesterol deposits. So if your cholesterol is very high, your total cholesterol, your LDL cholesterol, if these are very high, then it could lead to the formation of plaque, and that plaque can ultimately damage the artery walls as well as block the artery walls. High triglyceride also is another factor. Triglyceride is another type of fat that is present in your body, and this is something that we usually test for. And it is important to keep this under control. And it is also important to keep in mind that there is a cholesterol called as HDL, which is the good cholesterol. So it is good to have this kind of cholesterol, the HDL cholesterol, higher as compared to the LDL cholesterol. So these are some of the main factors that can, end up impacting the heart and cause heart conditions. Now, aside from high blood pressure or obesity or overweight and high cholesterol values, there are other factors that can lead to heart diseases, and also important why you keep this in mind. because these are a lot of these are preventable. We can control a lot of these factors. So that is why it is important to keep this in mind, that just because you may have a risk factor, that does not mean that you might end up developing a heart disease. So hypertension or high blood pressure, if there's too much salt in your diet, you must have heard that for patients who have diabetes or high blood pressure, it is important to control the salt in your diet. The sugar in your diet for diabetic patients, obviously, we need to keep that under control as well. Excessive use of alcohol or smoking, that can also damage the arteries of your heart as well as of your body. So it is important to either completely quit this. High blood cholesterol, like total cholesterol, LDL cholesterol, and triglycerides. uh, some people also have family history of heart disease. So you must have heard कि आपके family में आपके father को, mother को, grandmother, grandfather, someone must have had experienced a heart attack, and it so happens that sometimes someone in your family has it, and then it increases your risk as well, because obviously a lot of these conditions are genetic in nature. So if your father ends up having it, then there are higher chances that those genes are passed down to you, and then it increases your risk of developing such a condition as well. So family history is also important. Diabetes, like we mentioned, obviously a major risk factor for developing heart conditions. But like I mentioned, a lot of these factors can be easily controlled. They can be easily prevented if you take the charge, and if you're really resilient, and if you're really encouraged. You must follow the lifestyle modifications that your health coaches recommend to you, or the modifications that your doctor recommends to you. Okay. So we saw how the disease can be caused because of diabetes and the other risk factors that you might have. But sometimes heart diseases can also be silent in nature, that you might not know that you have the disease, and you can go about your day-to-day activity and not realize that you have this condition. काफी साइंस होते हैं, काफी किसी भी डिजीज के signs होते हैं, symptoms होते हैं, which you can notice and then talk to your doctor about it. आप अपने डॉक्टर के पास जाके कह सकते हैं कि I've started to notice कि मुझे ये सारे signs दिख रहे हैं. तो the doctor will then go ahead and evaluate you for that. वो आपका चेकअप करेंगे, वो आपका टेस्ट करेंगे based on the signs that you report. So it is important to keep in mind certain signs and symptoms in order to prevent anything untoward from happening. So some of the most common signs and symptoms, this can be different for different people. It can be different for men, it can be different for women. Some people might not experience all of these symptoms. Some people might just come across one or two symptoms, but it is important to keep an eye on each one of them in order to prevent, ending up in a hospital or in the emergency room. So some of the common symptoms are shortness of breath. Shortness of breath is nothing but सांस लेने में दिक्कत हो रही हो. अगर आपको लग रहा है कि your chest is feeling heavy, आपको बहुत भारी महसूस हो रहा है, आपसे सांस बराबर से ली नहीं जा रही है, this is one of the important signs. आप कोई भी समझिए, आप रोज वॉक पे जा रहे हो, आप रोज 30 मिनट्स का वॉक करते हो, बट आपने नोटिस किया है कि जो आप पहले 30 मिनट्स वॉक इजीली कर पाते थे, पर आपको अभी उसमें वो करने में दिक्कत हो रही हो कि आप 15 मिनट चले और आपकी सांस फूलने लगी. So that is a very important sign that in your day to day activities, रोज के कामों में अगर आपको रोज के कामों में भी अगर आपकी सांस फूल रही हो, so that could be one of the major signs that can be pointing towards a heart disease. आप easily थक जाते हो, जो पहले नहीं होता था. आपके जैसे मैंने कहा कि रोज के कामों में आपको अगर बहुत ही ज्यादा इजीली थकावट महसूस होती है, तो दैट इज अनदर साइन दैट पॉइंट्स टुवर्ड्स इट. आपके जॉ में पेन होना, आपके चेस्ट पे प्रेशर जैसा फील होना या तो चेस्ट पेन जैसा फील होना। चेस्ट पेन कैन बी इट कैन बी डिफरेंट फॉर डिफरेंट पीपल। किसी किसी को ऐसा लगता है कि जैसे कुछ भारी रख दिया हो, या तो फिर किसी को जलन सी महसूस होती है, किसी को एकदम जैसे कोई पिन घुसा दी हो चेस्ट में वैसा फील होता है। तो बट इट्स स्टिल इम्पोर्टेंट टू कीप अटेंशन टू दिस। कैसे भी टाइप का चेस्ट पेन और चेस्ट प्रेशर आपको फील हो रहा हो, आप अपने डॉक्टर के साथ जरूर डिस्कस कीजिए। काफी एंजाइटी इज जस्ट आपको अच्छा नहीं लग रहा हो, या तो फिर आपकी हार्ट रेट काफी बढ़ रही हो, लाइक ऑन अ रेगुलर बेसिस विदाउट डूइंग एनी एक्टिविटी। अगर आपको लग रहा है कि आपकी हार्ट रेट बढ़ रही हो, तो दैट कुड ऑल्सो बी अ साइन। कुछ कुछ पेशेंट्स को बैक पेन होता है, लेफ्ट साइड में पेन होता है, उल्टी जैसा महसूस होता है। These are some of the common ones. Even in women, as we can see that these signs are common. थकावट महसूस होना, फेंटिंग, चक्कर आ जाना, आर्म्स में, चेस्ट में, शोल्डर में पेन जैसा फील होना, चेस्ट पेन फील होना, उल्टी जैसा फील होता है, या तो फिर किसी किसी लोगों को पसीने भी छूटते हैं, टेम्परेचर नॉर्मल हो, कोई फीवर नहीं हो, तो भी इन लोगों को पसीने आना शुरू हो जाता है। तो दीज आर सम ऑफ दी कॉमन साइंस एंड सिम्टम्स। इन इसकी इंटेंसिटी काफी डिफर कर सकती है, कुछ लोगों को ज्यादा फील हो सकता है, कुछ लोगों को कम। बट आप इनको जरूर ध्यान में रखिए। अगर आपको कभी नोटिस होता है तो अपने डॉक्टर के साथ डिस्कस कर सकते हैं। नाउ जैसे मैंने कहा कि if you notice any of these signs or symptoms, it is important to go to your treating cardiologist or your treating physician and talk to them about it, so that they can also take preventive steps in order to identify। वो भी identify कर सकते हैं कि आपको सच में ये बीमारी हो या तो फिर कोई और बीमारी के कारण हो रहा हो, तो उसके लिए भी ट्रीटमेंट स्टार्ट कर सकते हैं। So, some of the main things that your doctor will start evaluating will be your blood pressure, since high blood pressure increases your risk of heart disease. आपका वेट कंट्रोल में है या नहीं, कोलेस्ट्रॉल लेवल्स कंट्रोल में है या नहीं, जस्ट टू अंडरस्टैंड कि अगर आपको हाई ब्लड प्रेशर भी है, आपका वेट कंट्रोल में नहीं है, आपका कोलेस्ट्रॉल भी काफी बढ़ा हुआ है, तो इससे थोड़ा बहुत अंदाजा डॉक्टर्स को आ जाएगा कि ये हार्ट डिजीज हो सकती है या नहीं। अगर उनको लगता है इन सब टेस्ट से कि ओके, I must go ahead and perform other tests in order to confirm it, then they will go ahead based on these factors. In addition to these normal things, there can be various other tests that your doctors will perform in order to confirm the diagnosis. कोई भी diagnosis आपको बताने से पहले डॉक्टर अलग टेस्ट करेंगे which are recommended for that condition. One of the important tests, some of you might have already done this, or some of you might not have, but ECG, called as the electrocardiography, this is some of the important test, one of the most important tests that can detect any abnormality in your heart. अगर आपके हार्ट में सिंस मैंने पहले भी कहा था कि आपके हार्ट में इलेक्ट्रिकल इम्पल्सेस होती है, वो एक पेस मेकर होता है। तो ये जो इलेक्ट्रिकल एक्टिविटी आपके हार्ट में होती है, ईसीजी इसको मेजर करता है। अगर उस एक्टिविटी में उनको उस इलेक्ट्रिकल एक्टिविटी के पैटर्न में उनको कुछ गलत दिखाई दिया है, या तो फिर वो बराबर से फंक्शन नहीं कर रहा है, then the ECG will measure it and then they will be able to tell you what kind of a condition is it, or whether it is even a heart condition or not. Echocardiography is आपने कभी अगर अल्ट्रासाउंड कराया हो, या तो फिर अब्डोमेन का अल्ट्रासाउंड या हार्ट का अल्ट्रासाउंड, कोई भी टाइप का अल्ट्रासाउंड हो, समझिए इकोकार्डियोग्राफी इज sort of similar to what an ultrasound does, just to check, but this is specifically for your heart, to check how the heart muscles are actually performing, how the heart is actually performing, whether it is pumping enough blood, उसकी कैपेसिटी रिड्यूस तो नहीं हुई है, अगर रिड्यूस हुई है तो क्यों हुई है. So this is a more in-depth examination of the heart as compared to the ECG. This is usually performed by a radiologist. Treadmill test is to evaluate the functions of your heart. So a treadmill test will usually be where a doctor or the technician will ask you to start working on a treadmill in the hospital itself. They will give you a treadmill. You will have to work on that treadmill. And then this treadmill is connected to various monitors that are checking whether your heart is performing properly for your age, your weight, your gender, and if everything is fine, that sort of rules that sort of rules out any kind of an impairment in your heart. So these are some of the tests that the doctors usually perform to eliminate or confirm the diagnosis of a heart disease. Uh, So obviously, if we know there are various risk factors for a condition, we know how these risk factors are impacting your heart, then we also know that there are other ways. काफी तरीके होते हैं कि आप उसको prevent कर सके. Some of these you must have already discussed, you must have already heard, but we have to repeat it because they are that important. Uh, these are very small changes that you can make in your lifestyle. These are not इसके लिए आपको कुछ फैंसी नहीं करना होता, इसके लिए आपको कोई फैंसी इक्विपमेंट नहीं खरीदनी होती. आप अपनी रोज की लाइफ में छोटे मोटे चेंजेस लेके आए तो यू रिड्यूस योर रिस्क of developing any kind of a heart condition. One of the major ones, as usual, is staying active. Obviously, by staying active, we don't mean कि आप जिम में जाके push-ups करे या तो फिर weights उठाए. Not that kind of an activity. It is important to keep your body moving. You can take a simple walk. You can go for a simple jog. You can just climb the steps of your building, like small things that you can do, because we understand that with age it becomes difficult to perform a lot of these activities, but it is important to stay active, because if you stay active, your heart stays functioning properly, and it prevents any kind of impairment from happening to it as well. So staying active, obviously, there can be different recommendations based on your preferences. If you prefer to walk, you can do that. If you prefer to jog, you can do that. Completely dependent on what your preferences are. Maintaining a healthy weight through a healthy lifestyle is also important, because being overweight or having a higher weight acts as a risk factor. So keeping your weight under control, keeping your waist circumference under control is very essential. Now, how do you maintain a healthy weight? This is a combination of various things. It's about staying active, staying physically active, and making healthy food choices. Our health coaches usually recommend what you can eat, what you cannot eat, what you should avoid. So try to follow these every day, and try not to every once in a while. We understand that during festivals we want to eat something sweet, we want to eat something oily and all of that, but on a day-to-day basis, it is very important that keep making these healthy food choices. Uh, Alcohol and smoking are some of the major factors that we can easily control. So if you are someone who often drinks or often smokes, then it is important that you quit both of these things, because smoking causes a major burden on your heart. There are various chemicals within the tobacco. There's tar, there's nicotine that causes damage to the arteries, to the blood vessels. So it is very important that you completely stop smoking. Getting enough sleep is a very important factor that we usually end up ignoring. 7 to 8 hours of sleep usually is what is recommended. It can be different for different people. But why is it important to get enough sleep? Is that your body, when you're sleeping, your body is still at work. It is repairing all of the damaged tissues, all of the damaged cells in your body. So it is very important that you get enough sleep in order for your body to repair all of the things, to maintain all of the things. Try to get every day 7 to 8 hours of sleep. Managing stress. You must have heard that under stressful conditions, the muscles of your heart sort of don't function properly. They Sometimes it can also happen that the muscles sort of tear, or it causes damage to the vessels of the heart. So it is important that your day-to-day stress is also managed easily. Talk to your family, talk to your friends about if anything is bothering you, how can you resolve this stress. Stress management becomes very important if you are at an increased risk of heart diseases. So try to keep this in mind. There are various people, or there are various support groups that you can reach out to in order to manage your stress. There are obviously, like we mentioned, following a healthy lifestyle, making good dietary choices is very important, and I'm sure health coaches must have recommended a lot of these things to you. But obviously, some of the things that you need to inculcate in your diet, or you need to follow every day, is stick to the green and leafy. Try to eat more green and leafy vegetables. Beans are also good for your heart health. Nuts contain some good cholesterol in them. So it is important to, obviously your body needs fats, it needs cholesterols in order to function, but it's also important to keep it under control. Nuts are a good source of good cholesterol. Try to sort of include them in your diet. Fruits like apples and berries are also essential. This is just a very short list that we mentioned over here, but the important factor to keep in mind is that it is important that you follow a healthy lifestyle. You can reach out to your health coaches on your calls or your chats in order to understand what would be best for you to ingest. Now, diabetes sort of directly impacts your heart. So, what can you do to control the diabetes? These you must have already heard a lot of the time. Try to keep your blood sugar levels under control. Uh, and by this, I mean not just your fasting blood glucose, or your post meal blood glucose, but also the HbA1c test that we usually get done every 3 months or 6 months. This also needs to be properly under control. Uh, Keeping your blood pressure healthy, keeping the blood pressure in the normal range, so that your heart is not working very hard in order to pump the blood. Normal blood pressure levels are under 130 to 80 mmHg. Uh, Obviously, if you have diabetes, it sort of makes different changes in your body. So we understand that different people have different targets, or they have different goals of blood pressure levels. So every time, even though 130 by 180 is the normal blood pressure level, your doctor might recommend something else to you, given the condition that you already have. So you have to take that into consideration as well. Not everyone is the same. Keeping your cholesterol under control, bad cholesterol like LDL or triglyceride that causes the plaque, or causes the buildup or the blockage in your arteries, that needs to be under control as well. The normal LDL cholesterol has to be lower than 100 milligrams per deciliter. Your triglycerides have to be lower than 100 milligrams per deciliter, and your total cholesterol needs to be under 200 milligrams per deciliter. I'll play a short video for you guys. I'm not sure if you will be able to hear it. Just let me know if you can hear the audio from this video.
Take diabetes to heart, linking diabetes and cardiovascular disease. Meet Michelle. Michelle enjoys spending time with her family, and in her spare time, she loves to cook and catch up on her favorite shows. She also has diabetes. And like many people with diabetes, she doesn't know there's a link between diabetes and cardiovascular disease. Cardiovascular disease includes conditions such as heart disease and stroke. If you have diabetes, you're more likely to have risk factors associated with heart disease, including obesity, high blood pressure, or high cholesterol. These put you at risk for heart disease and stroke. Over time, high blood glucose from diabetes can damage your blood vessels and the nerves that control your heart. And adults with diabetes are nearly twice as likely to die from heart disease or stroke as people without diabetes. But there's good news for Michelle. She can take steps today to reduce her risk, and so can you. Here's what you can do to protect your heart. Manage your diabetes ABCs: A1C, blood pressure, and cholesterol levels. Ask your healthcare team what your goals should be. Develop or maintain healthy lifestyle habits and learn ways to manage stress. Take medicines as prescribed by your doctor. Stop smoking or using other tobacco products. With lifestyle changes and a treatment plan from our healthcare team, Michelle can look forward to living a healthy life, and someone's very happy about that. So take diabetes to heart. Visit NIDDK.
I hope everyone was able to hear the video and
Yeah,
sort
yeah,
of
it is audible. Yes,
great,
yes.
great. So that video, उस वीडियो में जो भी हमने पहले डिस्कस किया था, वो सब कुछ समराइज हो चुका है. Maybe let's move on to the next. Yeah. So now that we've covered how does diabetes affect your heart, how can you control it, what are the various steps that you need to take in order to prevent heart disease from happening, let's see how much of that have you understood, and let's have like a couple of questions in order to test your knowledge. So, does obesity, high weight, or high cholesterol, are these not the risk factors for heart diseases? True or false? Please choose. That's correct. It's false because, like we discussed previously, these are very important risk factors for developing heart conditions. The second one, heart diseases can be avoided by managing the below. Yes, the answer is all of the above. You need to manage your diet on a regular basis, stay active, and also take your diabetes medication regularly without fail in order to control your blood glucose levels. And obviously, we did discuss a lot of these things. We discussed the importance of diet, exercise, and all of that. And it is important that in order, like every person is different, and all of you have a health coach assigned to them. Whatever questions you have regarding your diet or your exercise, you can easily reach out to them. They will give you your personalized plan. They will tailor it for your needs. They will tailor it for your preferences, so that it makes it easier for you to also follow them. So please reach out to them in case you have any additional questions on these things. They're always available to you. Thank you so much, guys. That was the end of our diabetes and heart health webinar. I think we'll be taking questions now, Rutuja.
Yes, yes, sure, Sneha. So we have already some questions from our, members. So let us address them. Hello, Mr. Chakravarti. Thank you so much for being an active participant. So, Dr. Sneha, Mr. Chakravarti wants to know if triglycerides increase in the blood, why sometimes persons get fainted and fell down, in which way blood flow will not be smooth. Yeah, this is the first question.
So, Mr. Chakravarti, like I mentioned, triglyceride is one of the types of cholesterol that if it is increased in higher level in your blood, it will get deposited in your blood vessels. And if something is depositing your blood vessels, it is narrowing the passage of that blood vessel. The amount of blood that is getting carried to your different parts of the body and your brain also reduces. So, if something like this ends up happening to an artery in your brain, suppose, obviously your brain is not receiving enough oxygen at that point, and this can also be associated with the blood glucose levels in your body. But when it comes to cholesterol, the fact that they block the blood flow in your artery is one of the major reasons why something like this can end up happening, because the blood flow is impaired. The blood flow is sort of blocked to different parts, and that is why this can end up happening.
Okay, that's great. Thank you so much, Dr. Sneha. Let's go to the second question. What is the difference between ECG and EEG?
So ECG is the electrocardiography. Cardio means heart. That means this is something that is measuring the electrical activity in your heart. EEG stands for electroencephalography. Encephalo basically means your brain. So anything that is measuring the electrical activity in your brain, that's called an EEG, and ECG is something that we do for the heart.
Okay, that's great. There's one more question. In diabetes patients, how heart attack will be felt when compared to non-diabetic patients? Is there a difference?
Yes. So we did talk about a lot of signs and symptoms and how it can be different for different people. But it has been seen in a lot of studies and in a lot of research that has been done on diabetic patients that a lot of diabetic patients, when they're experiencing a heart attack, it might be a silent heart attack that you might not realize that you're suffering from a heart attack, because sometimes you might not have the chest pain, or sometimes you might not faint, or all of those signs and symptoms might not appear. But however, even if something like this is something that you're not able to recognize, there are always signs and symptoms that occur previously, or that have been happening to the patients before an episode happens. So suppose today someone experiences a heart attack, or something like that. A week prior to that, or a few days before that, they will experience some kinds of signs and symptoms like chest pain, or difficulty in breathing, or they're feeling unusually tired. those are some of the precluding, or those are some of the signs that happen before that these diabetic patients might end up noticing.
All right, great. There is one more question asked Dr. Sneha. Which is the best exercise for diabetic and heart problem patients other than basic yoga?
So other than, this is something that you can definitely talk to your health coaches also about. But aside from yoga, there are some cardio exercises. You might have heard about, cardio, strengthening your cardio and all of that. So daily exercises, small exercises like just going for a walk for 30 minutes, 45 minutes, going for a light jog every day for 20 to 30 minutes, those can also be, some light exercise that diabetic patients can perform that have heart problems, because you don't want to exert a lot of pressure, or you don't want to exert a lot of force on your heart. If you, like I mentioned, if you go to a gym and start picking up weights, that is just going to put a lot of strain on your heart. And we're trying to avoid that. We just want to keep it healthy. So some light, moderate exercises, lightweight exercises like walking, jogging, climbing the steps of your building, those should be also enough to maintain your heart health.
Great. All right. We have some few questions. Let's address them as well. Hello, Rekha ji. Good evening. Thank you for joining today's session. So, Rekha ji wants to know what is the difference between LDL and triglycerides.
So, in a very obviously medical term, or in a very simple term, I can just tell you what the difference is. So, LDL is a low density lipoprotein. Uh, Triglyceride as well. It is a type of protein, a cholesterol protein or a fat protein. The only difference in these two is the type of protein or the weight of the protein that they are. That is like the simplest way that I can put it. There's just difference in the structure of the protein and how much they weigh in the body. That's like the simplest, I would say, difference between an LDL and a triglyceride.
Okay, great. Dr. Sneha, if you can tell us, there are few more questions, but I would like to just collate them because most of them mean the same. What are the best foods for high cholesterol? What are the foods which are good in HDL, and which foods to be avoided which are high in LDL? Was I audible?
Sorry, yeah.
Yeah, yeah.
Yeah, Rutuja, maybe if you want to answer this,
Sure, 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 sure. So, thank you so much. It would be great if you put up your names, as for us anonymous attendees could be a little misleading. So, if you can drop in your names when you ask questions, it will be really great. We can help you with a premium plan. Okay, because see, for every person, things which are rich in LDL or HDL or VLDL will differ. आपका बॉडी वेट अभी कितना है, कौन से फूड्स है जो आपके लिए हेल्दी है, कौन सी चीजें हैं जो आपको खानी चाहिए, कौन से फूड सी इफ यू आर ऑलरेडी ईटिंग almonds and if I tell you almonds are rich in HDL, that won't be a great option for you because you're already having a rich source of HDL. Instead, if I tell you why don't you have flax seeds or why don't you have pumpkin seeds, that will be a better option. Correct? So this totally can be customized. It depends on your current lifestyle routine. So for y'all, we have a special customized cholesterol management plan. If you want to know more, please reach out to your health coaches and they will guide you on this in detail. All right, thank you so much for your question. Let's move to the next part. Dr. Sneha, again, an anonymous attendee wants to know how does beta blocker medicines for controlling blood pressure works in reducing pressure. So let me take a minute here. Please understand, members, these all are medical technical information pieces. It would not be really great to give this information at a virtual scenario. If you want to know how do medicines work, what are the technicalities, what are the molecules present, how those molecules work, all of that your doctor can practically explain you whose treatment you are taking. So please ask him instead of asking a virtual coach support or a virtual program, because how do beta blockers work and what is the work of a blood pressure or a diabetic medicine? We can give you an overview, but not exactly particular to your medicine. So we don't want to misguide you. And that's the reason we keep this question to your doctor, so that next time when you go for a follow up, we can help you. Put this as a reminder. You ask your doctor and you speak to him. Hope that helps. Yeah. There's one more question, Dr. Sneha from Mr. Yadav. Mr. Yadav wants to know what tests can be done beforehand that coronary has been narrowing.
Correct. So, Mr. Yadav, if you have various risk factors and if you have been developing some signs and symptoms, the best way to see that your coronaries are narrowing is to visualize them, is to see them. And this is usually done through a procedure called as an angiography, where they will view the vessels of your heart. It will show them what is the degree of blockage, कितना blockage हुआ है. वो जो ब्लॉकेज होता है उसको भी डिफरेंट सिवियरिटीज और ग्रेड्स में कैटेगराइज करता है. तो अगर उसमें बहुत ही ज्यादा ब्लॉकेज हो तो इवन इफ यू डोंट हैव एनी साइंस एंड सिम्टम्स, देन your doctor will recommend something to you. If it is a small blockage, then they will recommend the other things that we have recommended to you. So procedures that can visualize your arteries and your blood vessels, like angiography, that is something that is usually done.
Great. All right. We have some few more questions. If my LDL is normal, HDL is high, but triglycerides is on the higher side, is that okay? What needs to be done?
So, if your LDL is normal, then that's great, because that is something that we call as the bad cholesterol, and it needs to be in the normal range. HDL is supposed to be high. It is supposed to be somewhere in the range of 40 to 60 milligrams, because HDL is the good cholesterol, and it is good to have it, on the higher side. So, if it is a little high, then that's great as well. But if your triglycerides are on the higher side, if they're greater than 100 milligram or 150 milligram per deciliter, then there are obviously certain medications that your doctor can prescribe to you. It is, if you have a report with you, you can take it to your doctor. There are various medications that they can prescribe in order to reduce this. But mostly your doctor will probably end up recommending adopting a healthy lifestyle in order to get it under control before prescribing medicines to you.
Great. All right. I think that has been a great discussion, Dr. Sneha. Thank you so much for taking out special time and being available on the last day of the year. Happy New Year to all our lovely AccuCheck Wealthy members. This year was amazing. Your health journeys are on the way. We are not going to give up. We are still going to help you on your health, on your diabetes management, on your weight targets, your inch loss. I hope all of you have a great, great year. I just have one suggestion. Please do not think of yourself as a patient. Don't think of yourself as I have diseases, I have health issues. Instead, try to work on them. We are here to support you. Happy New Year to all our lovely AccuCheck Wealthy family. Next year is going to be more exciting. New sessions, lot of webinars, and lot of information for all our lovely users. Meanwhile, happy new year. See you all next week with a new set of information and a new speaker. Thank you so much, Dr. Sneha. Thank you so much, AccuCheck Wealthy family. See you all next week. Bye bye. Happy new
Thank you,
year.
everyone. Happy New Year.